This video will demonstrate endovascular treatment of a recurrent large middle cerebral artery aneurysm using flow diversion. This is the case of a 62-year-old woman who has had long-standing headaches. 10 years prior, she presented with a ruptured MCA aneurysm that was initially treated with coil embolization. Upon imaging workup, she was found to have a recurrence of her left middle cerebral artery aneurysm. Here we see a 3D angiogram demonstrating neck recurrence at the site of the previously coiled MCA aneurysm. Flow diversion proceeds by first advancing a microwire beyond the neck of the aneurysm, in this case into a distal M2 branch. This is done with alternating advancement of the microwire as well as the microcatheter. We see the wire emerging beyond into an M2 branch, and the microcatheter is brought to that position. Once the microcatheter position is established, the wire is withdrawn. The flow diverter system is then advanced through the microcatheter. Of note, there is an approximately 15 millimeter distal wire at the tip of the deployment system. This is advanced to the edge of the microcatheter, at which point a roadmap is obtained to be able to precisely place the stent. Stent deployment typically proceeds in 3 phases. First, the flow diverter is unsheathed, followed by pushing of the catheter, which helps to compress it over the area of the aneurysm neck. Finally, it is unsheathed again to completely open the stent. We see here an AP projection that the flow diverter has opened over the entirety of the M1, M2 segment. At this point, the distal wire is captured. This is done by, again, re-advancing the microcatheter through the stent and over the wire to recapture and, along the way, iron out any kinks and unopened segments of the stent. The wire is then withdrawn, leaving the microcatheter in place. A follow-up run demonstrates some stasis of dye within the aneurysm. In this case, a second flow diverter was placed in order to further obliterate the aneurysm. The flow diverter system is again brought up through the microcatheter. In this case, we will employ a telescoping technique wherein the stents do not completely overlap, but overlap just over a portion. Here we can see the unsheathing of the second flow diverter within the first flow diverter stent. There is diastasis noted again within the residual of the MCA aneurysm. Here we see pushing of the deployment system in order to compress across the neck of the aneurysm, and this is followed by complete unsheathing of the proximal portion of the stent within the supraclinoid ICA. There is good opening of the stent, and we see complete opacification of the vascular tree with stasis within the aneurysm residual. Again, we note stasis within the aneurysm neck, and follow-up runs demonstrate good opacification of the normal cerebral vasculature.